Okay, so this is the face of our new strategy. Some of you may have got copies of it. It can be downloaded from the website, but we can also supply physical copies as well. So let's try and so what I'd like to do is give you a very quick overview of the strategy, and then Fiona is going to talk about the patient aid referral process, and then Aoife will take over for counselling, and then we'll all take questions depending on what the questions are, and then I'll just give you a quick intro, very quick, into the peer support, and then we'll conclude. And the aim is to have you all finish, because I know you're all such busy people, to finish by 2 o'clock. Okay. So our strategic objectives break down into 5 main themes. At the core of it is supporting patients and their families. That's obviously something we'll continue doing. So that's more about support for the clinical services. So counselling, patient aid, the support centre in Beaumont. And then we have Living Life Well, which is all about holidays. We have planned to introduce more activities. We have the sports team. And then we need to renew our branches. COVID obviously has had a huge impact on this, and a lot of our branches haven't been meeting, but we aim to renew the branches over the period of the strategic plan up to 2025. And then we'd like to do a lot more research, campaigning and advocacy. We have been doing this, but we want to develop a much stronger focus on those areas. And underpinning it all is organisational fitness. If we don't have the infrastructure to support all these activities, then we won't be able to expand, and particularly in the light of the Charities Act, and there's a new update coming as well, the new Charities Governance Code. So in each of these areas, we have specific objectives. I'm not going to go through all of these, but you can see there's a very specific objectives under each of these areas, where in each of these we talk about why we think it's important, how we're going to do what we're going to do, and what we expect to see as the outcome. So one of the key things would be, for every service we provide, there will be a detailed patient information sheet showing them exactly what they can expect from the service. And you can see that one of the key things is we want to collaborate with other organisations. You know, we are a very small organisation. One of the things I'm very surprised at how small the staff team actually is, given the impact they have. A lot of it is about our volunteers, but we need to work much more closely with other organisations, with healthcare professionals, in order to have more benefits for patients. So that's the strategy. Said it'd be quick. There's more detail if you want to look at the website, or we can post you out a printed copy of it as well. So we looked at our patient aid and our counselling policies, and we decided we needed to make them more transparent and clearer. So in terms of eligibility, both patients and families with end-stage kidney disease can apply for counselling or patient aid. So if they have a dialysis or a transplant, they're eligible. And if they're in pre-dialysis stage and under care of a renal team, they're also eligible. So somebody who might have been told you will need dialysis in 5 years' time won't be eligible, but if they're heading in that direction and they're under the care of a renal team, they will be eligible. Living donors and the families of living donors are eligible. And then the families of bereaved patients for 24 months following the death of their loved one, they'll also be eligible for both those services. So I'm going to hand over to Fiona now. Fiona, do you want me to move the slides forward, or do you want to do it yourself?
I can do it myself, can I?
Yeah, if you want, I can stop sharing and you can just share.
No, you fire ahead, Carol, because I might make it off. Thanks a million. Okay. Thanks everybody for coming on your lunch break. I know a lot of you. There's lots of you that I haven't met in person, but it's been great to stay in touch with you on the phone and email and every which way. So as you know, we developed our new patient aid policy, and I know I would have mentioned it to people along over the last couple of months. And we got it approved by our board. And the reason for that was to put some structures in place to ensure we're in line with our governance code, and to make sure that we're able to identify the key needs of the patients that we are working with, and if there's any other needs that are being identified over the course of this year, or what has come, what was handed over to me basically when I took up the role. So like, for example, there was a home dialysis grant that had this kind of figure on it, but nobody knew why the figure was there. So we've been able to tighten that up a little bit. So some of you will be familiar with the grant application form that's now on the screen. This was the first part in the process. So this is where we get the majority of the information. Now, this is a grant application form for a patient to fill out themselves. There's also a referrers grant application form. So it's who you are and your job title, and if you have consent to make this application on the patient's behalf. It comes in PDF or Microsoft Word. We don't have a more advanced software for like form filling and stuff like that, but it's working really, really well at the moment. And the amount of information that we're getting from people, so this is your form, and then I have a thing on the back of it for follow-up for me. So whether they need to be redirected to different agencies, etc., which the majority of people do. So it's more of that. It enables us to give that wraparound service. It is a work in progress with the application form. So if there is something that you notice that you think should be on the form to capture particular information, please feel free to tell me, because like I said, it's a new initiative. When the patients send it in, then I keep it on file, but I keep everything remotely. I don't use any paper files, which has been fantastic, to be honest. So everything is kept on Salesforce, so in their own confidential folder, the patient's own confidential folder. And like I said, it has made it much more secure for us. So talking about the grant application form obviously comes in, and when we assess the patient, when we assess the application, we decide what kind of a grant would suit this application. So if you want to click on, Carol. So based on the feedback that we've had from healthcare professionals and patients and my colleagues in here, we broke them out into a number of different categories. We also liaised with other charities to see what they were offering and why. So there's the Exercise and Healthy Living Grant. That can come, all of these grants can be applied for either a self-referral or from a healthcare professional. Some of the grants can be increased if they're being applied for with the recommendation of a healthcare professional as well, and the Exercise and Healthy Living Grant would be like that. So that would be like access to a gym, there's access to the XWell programs, etc. The Wellness Grant was something that a lot of people were very passionate about developing, and it's specifically for people that do not have the option of a transplant. So it's to give them the opportunity to take part in some respite, whatever they deem to be respite. That could be going to get a facial or going away for a weekend. So they can apply for that. And what I do is, in order for me not to get involved in the actual booking of stuff and to protect me and the IKA, we transfer that to the patient when they ask for it. We don't recommend places to go or anything like that. Then there's the general patient aid, which is probably what you all have been applying for since I started. So the majority of it would have come under that. There's an independent living grant, and that would go towards the likes of driving lessons, setting up, your own business, setting up, getting prepared for job interviews, courses. We've had some really, really great applications around that due to, the differences, the different interests that people have, and the fact that kidney patients often need to work different hours. So, they can work the likes of shift work, and they can apply for the grant based around that to meet their needs. Then there's an additional needs grant. The additional needs grant is like, it would have been maybe referred to as like the hardship grant before now, and it's a larger grant. It's a larger monetary grant, but it's specifically for emergency crisis kind of situations. And what we would see an awful lot of applications for that would be deemed additional needs grant would be a bereavement, funeral costs. We know a lot of people with kidney disease wouldn't have life insurance to cover funeral costs and that kind of stuff. So we'd be able to give a contribution towards that. And then there's also like the additional needs could go towards, there's been a huge hike in the ESB bills at the moment, as everybody knows. So it will kind of go towards that. We have some people that are applying for visas to remain in Ireland, and their visa can cost quite a bit. So it's really, really varied. And then there's the holiday grant. So there used to be a holiday grant given to everybody that went to the holiday homes in Ireland, but that changed and it's now based on need. So the only thing that divides accessibility to these grants is if you are a member and if you're not. Thanks, Carol. So the grants that are open to non-members are the general patient aid and the additional needs, because they're more like the crisis intervention grants that we can meet the needs immediately. But in order to, I suppose, continue to grow our organisation, and like Carol mentioned in the strategic plan, we want to reach as many members as possible. And in order to do that, we have to have some incentives. So the exercise and healthy living grant, wellness, independent living and holiday grant are for members only. And anybody that has applied for a specific grant, and I've gone back and said, like, you would be entitled to this, you will need to become a member. They're quite happy to become a member, didn't realise they weren't a member, and didn't realise that there was other things that they could benefit from, like our support magazine and having a say in the direction of the IKA, etc. So they've basically been, that's basically the dividing the two. The reason we kept some grants open for non-members is that we felt that we didn't want to exclude anybody. You can move on, Carol. So this is just the process. And as you probably know, like everybody else, the service has gotten extremely busy over the last couple of months. And what used to take a week, like I don't know how many of you would have worked with the other patient support manager before me, but I know they would have turned around grants within a week, and it's just not possible anymore. And the reason for that is reporting and trying to gather data, but also to make sure that the grants are going to the correct people and to make sure that we're in line from a banking perspective as well. So on receipt of the application form, whether I get it through email or post, generally if it comes in email, it will be seen quicker, but the process is still the same. So when it comes into me, then we decide which grant is most suitable to patients' needs. The patient will be contacted by myself or an assistant to advise them of the outcome and how much they've been approved for. At that point, I will say to them that it's not required that you would need receipts in order to receive the grant, because people aren't looking for money if they've already got the money to spend on things. We know that. So, but what I will be saying to them is that we would expect some kind of receipts. We're trying to create a dossier to show the additional costs of living with kidney disease. So it's not always a trust thing, but it's good for my audit as well. And then we're really moving towards bank transfers because it's cleaner, it's safer. We're not chasing checks. It is an awful lot more work on our accountant, on our head of accounting. So that is why now it takes between 2 to 3 weeks to process each application. And nobody has complained, in fairness. Everybody's been really, really patient. And if there has been an emergency, we had an emergency, for example, yesterday, we do everything within our power to try and meet the need immediately. If and when, but what we're trying to move away from is the fact that patients might see us as an emergency service to access funding, and try to make them think a little bit, strategically about what they might need coming up to September and stuff like that. So that's everything. You can get the application forms from myself. I know I've emailed them to everybody. Well, anyone that I had been contacting. So after this, I have an updated application form now. So after this, I'll get one sent out in a Word version and a PDF version to you for the referrers application form. But aside from that, that's me done. I hope that explains it all.
Great. Thanks, Fiona. That's great. And we're going to move quickly on to counselling. And then after that, we will take all the questions.
Yep. Thanks, Carol.
Okay. I'm just waiting for the technology. Okay.
So, yep, thank you all very much for taking the time to be here today and for all the referrals that I receive from you. Over the last 2 years throughout COVID, our service, the counselling service itself, has increased by about 37%, which is a huge increase for our actual referrals. And it's great that people are actually reaching out to get the support that they need. So the counselling service that we do provide here in the IKA is a client-centred and it's a trauma-informed service. The service is provided by myself, so I see patients here in Donor House, and then I have a panel of accredited counsellors throughout Ireland who work on our behalf to support patients, their families and their carers. So at the moment, well, previously in our policy, what you would have known was that patients were granted kind of or authorised 6 sessions for each patients, their families and their carers, and that the patients must have been living in Ireland. When you become a member, and again, for like reasons Fiona has just said, that we have extended it to a maximum of 36 hours. That's around 9 months of counselling for a patient, which is quite an extensive and significant amount of counselling for patients, because they can choose to kind of spread that out towards the end to get the support that they really need, because we really know that 6 sessions is really, you know, a toe in the water really compared to living with a chronic illness. So we're really trying to meet the needs of our patients and support them throughout that. In cases where additional counselling may be required beyond the 36 hours or 36 sessions, a case can be made by the assigned counsellor to myself or yourselves. Any of the healthcare professionals can come back to me and I can talk about it and it can be approved by management then. So the referral process is straightforward enough. A lot of people just ring or email me, and that's the main kind of form of contact. And it is really important that they have given you consent to pass on their details to me, and that they've given consent that I can actually pass on the details to a local counsellor if they end up with a local counsellor. So when I get the details, then I will give them a call and I'll discuss their needs with them. So I'll explore, you know, what kind of counselling they might need, whether it's online or in person, if they have any preferences to male or female. And then I will go and I will contact my panel of therapists and assign them a therapist. Once I have that done, I'll contact the patient, and then the patient, it's up to the patient to contact the counsellor themselves and make an appointment. They need to kind of follow through with that. And sometimes that can be lost a little bit because they want to do it. So if they feel, you know, that the counsellor can contact them, I'll ask that as well, just to make it easier for the patients. But we do encourage them to kind of take action for themselves and make that contact. Once they start the counselling, from the 1st of August, they're going to receive referral packs. The counsellor will receive a referral pack, and then the patient will receive a patient pack. So the referral pack for the counsellors will be contracts and coded fee sheets and invoice and things like that. For the patient, they'll just get a leaflet of counselling information and process, you know, talking about the duration of the counselling and what they can expect, and then a feedback form as well, so that when they're finished counselling, they can feedback that information to me. Once the sessions start, I authorise them in blocks of 6. So if they want to continue on with the counselling, that's when they become members in that 6 weeks initially, if they feel that it's going to take more than 6 sessions. And then after that, the counsellor themselves or the patient can contact me to authorise further sessions. And then at the end of it, you know, when they stop counselling, we do ask for feedback just so that I can improve the service, or if there's anything I'm missing, that I can put that in place for the patients. So all the counsellors that I actually use, they must be accredited. I can't use pre-accredited therapists, although there might be very good therapists out there that are pre-accredited, but they must have that experience. Patients can be very vulnerable, and for me, it's a layer of kind of comfort to know that these are very experienced therapists. So, and they must kind of remain in good standing with their own professional association. We do now issue contracts to them, and they must sign it and return it to me to indicate their acceptance of the terms and conditions that we have within our policy in the IKA. All counsellors engaged in the provision of counselling on behalf of the IKA are actually required to have in place all the professional and legal requirements it takes to run their own actual practice. The implementation of policy will be I'm hoping to have it up and running by the 1st of August. But there'll be that transitional phase to allow clients to engage in more counselling or finish up in therapy under their existing contracts, or allow all the counsellors to be trained in trauma approaches. Trauma informed is a very important approach for us. And we have asked them now to actually be trauma informed certified. So this time frame allows them to complete that training. I'm not sure if any of you are familiar with trauma informed, but if you want to move on there, Carol. It's a practice that it's an approach really that explicitly recognises and acknowledges the effects of people's lived experience of trauma and the role that trauma might play in how they cope with their lives in this or their illness today. So this approach really means that every part of our organisation understands the effects of trauma on individuals. They serve and promotes a cultural and organisational change in responding to the client's needs. A lot of the time when we think of trauma, we think of it as a childhood trauma, so like abuse, neglect, household dysfunction. So whether that's, addiction, mental health, divorce. So we associate trauma a lot of the time with children, but often illness itself is trauma. Having operations is trauma. Sometimes watching the patient's blood come out of their arm can be very traumatic, and while they're on the dialysis machine. So sometimes what can happen if they do have childhood trauma, that can be triggered now again by the trauma they're going through, which really affects how they cope with their illness and their experience of their illness. So what we try to do within the Irish Kidney Association is follow the principles of trauma-informed approach. If you want to move on, Carol, there. So mainly it's the safety and stabilization of our patients, and there's trustworthiness and transparency between us, that we kind of provide the peer support and build that partnership and collaboration for patients, because that is really important with people that are chronically ill, because it helps them to feel empowered, to hear their voice and to have choice. You know, it addresses any cultural, historical or gender issues that might have arisen. And what we're trying to do is prevent further traumatization or re-traumatization of your patients. So that's just a small kind of introduction into trauma informed, just to kind of give you a background of how we approach therapy or where we're coming from within our service. And the information, I do have a new referral form, but it's just in the process of being approved. And when, like Fiona has hers done, and mine will be done shortly, and we'll email them out to you as well. But just in the meantime, I suppose consent is the main thing. Has the person, like I said, consented to you contacting me to organise the counselling? Has the person consented to me sending their contact information to local counsellors? And then just their general information, their name, their phone number, the contact details. If you know the location that they might want to attend counselling, their preference in relation to in-person or online, or whether it's male or female, they can be good details to have. But if you don't have them, you know, it's really just their name and contact details, because I will get all of that information when I have that first kind of discussion with them, and when I do call them, make contact with them to arrange the counselling as well.
Okay, great. Well, I'll share a screen again and just talk about peer support. Basically, there's a lot of research to show that just being able to talk to another person can be really helpful who has gone through the same experience. So we last year we commissioned an expert to review other models, and we ran a number of focus groups with patients to find out what they needed. And peer support is happening informally throughout the IKA, the cups of teas, going to branch meetings, emails, support magazine, you know, when people actually sit down to discuss it. But the trouble is COVID has had such a huge impact on it. The other thing is that there's a certain level of training needed, that you can't just expect because somebody is a patient that they're also a good listener. So we've been doing a lot of work behind the scenes to actually launch a formal peer support program, where it'll basically be a referral is made. Aoife looks at it and agrees with the person whether counselling is more appropriate or whether peer support is more appropriate. And then they will actually may refer to a peer supporter. And we're gathering information to try and inform the matching process because we want to try and match people to somebody who's actually going to have a good relationship with them. So, and also the stage of disease that they're at, or whether they preference for a male or a female. So we had a really good session Monday night, where we launched a recruitment event, and we had about 30 people at it, and the level of interest was amazing. So we're training up, we'll have a recruitment and a selection process, and we will be training up people to deal, active listening, the policies and procedures of the IKA, how to do self-care, how to establish boundaries, what to do if, say, somebody is displaying suicidal tendencies. And there will be a supervisor and supervision network, and basically develop a community of peer supporters. Now, initially, this is going to be all online because with COVID, it's just impossible to plan anything. But the intention is, it's a core part of our strategy, that eventually we will have a huge community of peer supporters, and that eventually we will be going to the HSE and saying, we think it would be a very good idea for you to fund having peer support workers in renal units operating as part of the professional team, because this is happening in mental health in Ireland. And actually in Ireland, we're actually quite advanced compared to other European countries on peer support workers. But this is a very small stepping stone. And we hope to launch it in October after we've done the selection. So, and the technology works. It's frozen again. Next. There's a whole website page around this called www.ika.ie called Peer Support, and it has the volunteer role description, it has the expression of interest form, the slides which provide a lot of information about what is the commitment required in order to train as a volunteer role. We'd be looking for people to commit about 4 hours a week once it's up and running, plus supervision time. But there is 5 to 6 days of training being planned as well. And if you have any patients who might be interested in this, we'd be delighted to hear from them. And the closing date to express your interest in it is the 15th of July, 2022. So on the website, the recording of the session on Monday is on that as well. So you'll be able to find out a lot more about it there. So we're really excited about this. I've worked with peer support groups before. I could see the difference they make. It can really make such a huge transformational change for people, and we're just delighted. It's the first time we're actually doing a recruitment and selection process of volunteers to make sure we get the right people, and the interest in it is just amazing. So we're delighted with that. We're doing a lot of other stuff, but they were the main messages we wanted to share with you. You can see, hopefully, there's an awful lot happening. We're still running a deficit. So obviously that's a problem for us, but within that, we're still trying to make our services more cohesive, make them more patient focused, make them easier to access. I think that's really important. And for yourselves as healthcare professionals, that we minimize the workload you have to do to actually engage with us. We want to make that as seamlessly as possible, because we really do get the amount of pressure and the long hours and that you're working in, and we really appreciate all the work that you do. And it's been one of the really interesting things for me coming here, when I talk to healthcare professionals and talk to patients, that the bond between patients and the people supporting them, yourselves, is just so amazing. And I find it unusual. I've worked in healthcare for a while, but I think maybe it's because patients are coming back time after time. So many other chronic diseases, you live the disease at home. You see your consultant once every 3 months, or your nurse once every 3 months, whereas a kidney, you're in and out of dialysis. And it's really been very, chatting to a lot of you, it's been, very inspiring, the dedication that you guys bring to the patients and the relations that are formed. And, I've noticed that when patients die, it's like a family member dying for many of you. And that's really impressive. So we're really committed to working with you. And if you have any feedback on our services, and we do hope to do a lot more on advocacy and on campaigning. We haven't got somebody in place yet. We just have a part-time person. So we do need to resource up to do that, but certainly we really want to work very closely with you to try and, you know, work as a team, because I think when we work as a team we can achieve a lot more than, you know, if we're not working in isolated silos. So very happy, you know, Fiona, Aoife and myself, very happy to receive any feedback where you think we can make more of a difference. We do have a problem in that there are so many issues we could campaign on. Every day I hear about something that we should be doing something about. And what we need to do is develop an overall strategy, you know, we've had an initial session with patients about what would the perfect healthcare system like, but we need to do a lot more detailed work to really understand what's important to patients. And we're a patient-led organisation. Our board are all patients or family members of patients. So we need to develop an overall strategy for campaigning, because, you know, as I say to the board, you look at cancer, you know, the Cancer Society, and they've an income of 22 million. And, you know, they've much more resources in healthcare terms. Kidney is kind of like forgotten about. Our total income is 1.2 million. Now, we do punch above our weight in terms of organ donor awareness, but we need to do lots more, like even the fact that, you know, there's no screening program for kidney disease. That's something we campaigned on earlier this year, and we've made submissions to the Department of Health on that, and we're awaiting a response. So we're really open to hearing from yourselves. I know you are very busy, so even a quick one-line or a quick phone call when you're making referrals, we'd be delighted to hear from you. So unless there's any other questions or comments, we're actually well ahead of time. There's one more message coming through there. Oh, that's Jared saying thank you very much. Thank you very much, Jared. It's great to see so many of you here. Really, really appreciate it. Yeah. So thank you all, and hopefully we'll be getting more referrals and grants and in from you. Okay, thank you.
Thank you. Thanks, everybody.
Thank you.
Thank you.
Bye.
All right. Good to see you all.